Hello, everybody, and today we're going to continue my review of Robert Whittaker's very important book called Anatomy of an Epidemic. You know, more people in this country take drugs for mental and emotional disorders than take drugs for diabetes, and think about how much attention we spend, and we should spend, on diabetes and trying to prevent people from getting it and trying to treat them and all that sort of thing. So that's why I'm spending a lot of time on this. I really do think this deserves a lot of attention. As I mentioned in Tuesday's broadcast, I'm going to spend some time today talking about schizophrenia. This is from Whittaker's book. And historically, schizophrenia is not a new thing. It goes back hundreds of years, and mental patients historically were confined to institutions. But after World War II, some reporters did exposés of the institutions, and I think people really got the idea that this was very similar to Nazi concentration camps. I mean, these people were locked up. It was deemed best to lock them up so that they couldn't get married and reproduce. They needed to be separated from society. And so there was a lot of pressure to release patients from the hospitals. And between 1946 and 1954, before Thorazine was used to treat schizophrenics, patients weren't medicated. And the records show that the discharge rate, sending people home, was between 50 and 85%. Only 20% of the patients were unable to improve enough to be functional and go back to some type of normal living. Yet the medical profession tells us that the reason why schizophrenics can function at all, I don't know many schizophrenics that are functioning, to tell you the truth, based on drug treatment, but the reason that they're able to function is because drug treatment has allowed them to live outside of mental institutions, but that's simply not true. And furthermore, studies of schizophrenics after Thorazine was introduced show that the discharge rates were much lower for those who were given the drug than for those who were not medicated. In 1955, proof of efficacy for drugs was not required. They were theoretically supposed to be proven to be safe, although I have some questions about that. But the National Institutes of Mental Health convened a conference to look at the use of drugs on mental health patients. And one of the problems in evaluating efficacy is that it's almost impossible to conduct a double-blind, placebo-controlled study with the drugs because the side effects are so awful that the people who are taking the drugs definitely know that they're taking the drugs. Furthermore, measuring outcomes is so subjective. I mean, how do you rate somebody's improvement? They're having fewer hallucinations or less outbreaks of some type of absurd behavior. It's a very subjective thing. But anyway, they did, in spite of all that, organize some double-blind, placebo-controlled trials with the idea that doctors and nurses could rate patients on a numeric scale. The trials would last for only 6 weeks, which, as it turns out, was very deceptive. The studies showed that schizophrenics treated with drugs did show more improvement than patients treated with placebo during the 6-month trial period. Further studies were conducted where the patients were withdrawn from the drugs and the relapse rate was really, really high, which was interpreted to mean that the drugs were really necessary and they kept patients under control. But there were no studies that looked at the effects of gradual withdrawal or that compared drugged patients to those who received only therapy. In fact, when we have to compare patients who receive drugs with those who receive only therapy, we have to go back years, decades of time before the drugs were introduced because now they're pretty much given to everybody. But a very disturbing pattern evolved. The National Institutes of Mental Health conducted follow-up studies and showed that those patients given placebo were less likely to be rehospitalized than those who were given drugs. In other words, in the short term, and that's why the 6-week trials turned out to be a bad idea, the patients were actually calmer, but the drugs caused more psychoses in the long term. Furthermore, relapse was actually higher in the drug-treated group and was dose-dependent. Only 7% of patients on placebo had a relapse. 65% of those taking the drugs had a relapse, and the more drugs they took, the higher the risk of relapse. But when those patients tried to stop taking their drugs, they experienced severe physical symptoms, including vomiting, insomnia, headaches, and tics, and almost all felt that they had to stay on their drugs. More and more studies show that drugs cause patients to get worse instead of better, and some doctors started suggesting, what a thought, that perhaps a psychotic break was a coping mechanism for some people who could recover on their own if treated without drugs in a supporting environment. But you see, there's no $1 billion to be made treating people with a supportive environment until they get over whatever's bothering them. Studies increasingly showed that the withdrawal symptoms were not a sign that the drugs were useful, but that the brain had altered its function in response to taking the drugs. And I spoke about this on Tuesday, that people don't have a chemical imbalance when they start taking the drugs. They develop the imbalance as a result of taking the drugs. Taking the drugs made the patients need them for life, but almost guaranteed that they would remain mentally ill and have more psychotic episodes. The drugs caused worsening schizophrenia, which resulted in the need for more drugs. From a marketing standpoint, you just couldn't make up anything better than this, but from a public health standpoint, you couldn't develop anything worse. Animal studies showed that for every month of treatment, 2 months of recovery were required, but at some point, the damage was just irreparable. What happened next is a testimonial to the power of money to influence medical care. Money trumps science. A few scientists reassured everybody that the drugs were useful, and psychiatry was able to continue the fraud. And today, it's actually considered controversial to bring up the idea that the drugs may not be useful because everybody knows they are. And I can speak from firsthand experience about it being controversial to bring up the idea, because every time I put out any material on this, I get a lot of hate email and hate phone messages from people who tell me that I'm irresponsible for even suggesting that the medical profession might be covering up the true results of these drugs. In the meantime, long-term follow-up of patients indicated that those who did the best were those who discontinued their medication on their own, and that those patients did better who were living in countries where the drugs were not commonly used. They fared best of all. The best results were reported in Agra, India, where only 3% of patients were medicated. The highest penetration of drug use was in Moscow, and their patients fared the worst. These results held up in studies that followed patients for between 15 and 25 years all over the world. Additionally, it was discovered that antipsychotics cause brain damage. The longer the drugs are taken, the more brain tissue is destroyed and the more damaged the frontal lobe becomes. This results in cognitive impairment and more psychotic behavior. The cure is actually worse than the disease, and the longer we treat these patients, the less likely it is that they'll ever be able to return to normal society. Why are psychiatrists not willing to acknowledge this? Well, one is the people they see repeatedly are those who are on the drugs and remain sick. The patients who recover and go on to lead their lives without medication, they don't go see psychiatrists anymore. And a significant number of people have simply helped themselves get off the drugs because the profession is notoriously not cooperative in helping patients in this regard. Since the introduction of drug treatment, the disability rates for schizophrenics have grown from 267,000 to 2.4 million, or 1 in 125 Americans. Actually very scary. So next week we'll continue the series. We'll start on Tuesday with a talk about what happens to people with anxiety when they do and they don't take the drugs. As always, feel free to pass this video clip on to anybody who you think would benefit from watching it. Thank you so much for listening and have a great day.